Cardiac arrhythmia is an irregularity of the heartbeat that causes the heart to beat too slowly, too fast, or irregularly. There are different types of arrhythmias. Most arrhythmias are not particularly dangerous. However, some may be life-threatening and do require immediate medical attention. The treatment of cardiac arrhythmias may require long-term medications or electroshock to the heart. Rarely, surgical procedures are necessary in order to implant pacemakers or defibrillators. This patient education program explains what arrhythmia is. It also covers the causes, symptoms, diagnosis, and treatment options of arrhythmia. The heart. Understanding how the heart works helps to understand arrhythmias. The heart is the most important muscle in the body. The heart has two sides, the right side and the left side. Each side of the heart has two chambers, an atrium and a ventricle. Let's watch how blood flows through the body. After the body uses oxygen that is in the blood enters the heart through the right atrium. The right atrium contracts and blood is pumped to the right ventricle. The right ventricle contracts and the blood is pumped to the lungs. In the lungs, the blood is loaded with the oxygen that we breathe. From the lungs, the oxygen-rich blood goes to the left atrium. The left atrium contracts and the blood is pumped to the left ventricle. The left ventricle contracts and the blood is pumped to the whole body through the biggest artery, the aorta. In the body, the organs and tissues take oxygen from the blood. Finally, the blood goes back to the right atrium and the whole cycle starts again. Heart contractions are synchronized. First, the atria contract together, and then the ventricles contract together. A normal heart rate at rest is usually between 60 and 100 beats per minute. The muscles of the heart contract and pump blood because a small electric current activates them. The electric current starts in a place inside the heart called the sinus node. It causes the atria to contract and pump blood to the ventricles. From the sinus node, the electric current travels through fibers that are like electric cables to another area of the ventricles called the atrioventricular node, or AV node. From the AV node, the electric current goes to the ventricles and causes them to contract and pump blood. The heart can pump as fast as 150 beats per minute in response to physical or emotional stress. It can also slow down to 50 beats a minute while a person is at rest. Different people have different heart rates during physical activity or at rest. This is normal as long as the blood pressure does not drop too low due to an increase or decrease in heart rate. The blood pressure is generated by heart contractions. Cardiac arrhythmia. Cardiac arrhythmia is the name for different conditions that cause the heart to beat too fast, too slow, irregularly. An abnormally fast heart rate is called tachyarrhythmia because tachy means fast in Greek. An abnormally slow heart rate is called bradyarrhythmia because brady means slow in Greek. Other irregular heart rates are simply called arrhythmias. There are different reasons for arrhythmias. Arrhythmias may occur if the sinus node is not able to generate enough heartbeats, the rhythm of the sinus node becomes abnormal, Other areas in the atria take over the function of the sinus node. Other arrhythmias occur because there is an interruption in the electrical wiring of the heart, causing the ventricles to beat separately from the atria. In the worst case, the ventricles are not able to beat effectively, creating a condition called ventricular fibrillation. When this happens, the heart cannot pump blood and the patient dies quickly. The most common reason for sudden death is ventricular fibrillation. Symptoms. When the heart rate becomes irregular, a person might feel any of the following sensations in their chest: palpitations, throbbing, pounding, thumping, fluttering, a feeling like the heart skipped a beat.